Zari from Tehran University of Medical Sciences. Dr. Zari, please start your presentation and share your slides.
In the name of God, hello everybody. My name is Azadeh Zari. I am PhD student of Persian Medicine at School of Persian Medicine, Tehran University of Medical Sciences. I won't take your time about COVID-19 anymore, and I will start my speech about copying, my speech about the copying efficacy and auto-saturation of COVID-19 patients, a case series. As you know, cupping is a traditional therapy used worldwide, and dating back at least 2,000 years ago, is divided mainly into dry and wet cupping, and also fixed and moving type. Cupping is a popular traditional therapy in Asia, the Middle East, and Central Europe. Cupping has long been used to treat chronic conditions such as musculoskeletal pain, headache, radiculopathy, and also respiratory disorders.
Excuse me, can you go to the slideshow so we can use a full screen mode? Thank you.
The effective results of cupping in respiratory diseases and symptoms such as cough and dyspnea have been repeatedly reported in clinical trials. For example, these results have been reviewed and reported in 12 clinical studies on 1,533 patients during the years 1998 to 2018. That is a high sample size to prove the effectiveness of this method in respiratory disease. So we constructed a case series of 3 patients with respiratory symptoms and suspicious to the coronavirus infection in CT scan, who were admitted to the corona ward of Imam Hospital, Tehran, Iran. Patient symptoms include fever and chills, dry or productive cough, dyspnea, myalgia, headache, fatigue, and anorexia. The patients, despite drug medications, including chloroquine and Caletra, after at least 3 days, were oxygen dependent. Posterior upper thorax location is recommended for cupping in lung diseases in Persian medicine. Therefore, in this clinical study, cupping was performed 4 times a day for 3 days to help the patients breathe better. So we decided to use cupping as a complementary treatment to improve patients' breathing better. So dry, warm cupping was done on both sides of the spine in both fixed and moving types. We put cupping glass in line with T4 vertebra on both sides of the spine for 5 minutes in fixed type, and then continue for 10 minutes in moving type. This is the chart of each patient and the changes of O2 saturation before and after cupping. As you see, we perform the plan 4 times a day, every 3 hours, and you can see the changes. This is the line of the base of O2 saturation changes of each patient. The third patient had a drop in O2 saturation in third day because he had tachycardia as a complication of new drug atazanavir, and so we couldn't do cupping for him at third day. From the viewpoint of conventional medicine, there are few theories and hypotheses that explain its mechanism of cupping action. Changes in the structure of the skin and increase in blood flow are explained by the mechanism nitric oxide theory. Immunomodulatory effects of cupping therapy are also expressed with activation of immune system theory. Cleansing the body of toxins is also explained by blood detoxification theory. All of these theories indicate that cupping can have good effects in the treatment of various diseases. Cupping also increases the circulation of blood and detoxifies the body from toxins. The negative pressure created under the glass acts as a stimulant to the subcutaneous tissue, and by increasing subcutaneous blood flow, it stimulates the autonomic nervous system. Cupping is involved in activating the complement system and regulating cellular immune system, and also investigations show that it can decrease the number of lymphocytes in local blood and increase neutrophils as an antiviral mechanism in virus infection. Results of our clinical trial show that the O2 saturation of the patients increased rapidly after cupping, and it stays stable for up to 3 hours. Also, after the second day, the basic oxygen level went higher, and the number of oxygen drop attacks decreased. 2 patients were discharged from the ICU and transferred to the ward. After more 3 days follow-up, the condition of the patients was completely stable. And at last, it seems that cupping as a simple, non-invasive traditional method could be a good and beneficial method to increase oxygen saturation in the patients who were infected by COVID-19. Thank you for your attention.
Thank you so much.
Okay, thank you, Dr. Zari, for your very nice presentation. We have some minutes from the presentation of Dr. Han. Dr. Han?
Thank you.
Dr. Han. Dr. Han. Yes, please continue your speaks. Your speak was discontinued and we missed the last minutes of your speech. Please continue and finish your speech. Thank you.
Thank you, Chair. Gave me an opportunity to continue present my work. This picture, so the microscopic picture compared the similar group after LPS and 6 hours and 24 hours, we can see the FITC level albumin leakage out of microvessel and the leakage. However, pre-treatment or post-treatment with the Qingfei Baidu Tang inhibited this albumin leakage. This picture shows the HE staining lung tissue compared with the similar group after 6 hours or 24 hours LPS injection. We can see here the edema and the leukocyte infiltration can observed of the microvessel. However, post-treatment or in the pre-treatment or post-treatment with Qingfei Baidu Tang markedly reduce this change. But in China, seven Chinese formula recommended by Chinese government, Jinhua, Qinggan, and Lianhua Qingwen for used chronic, and Qingfei Baidu Dang, totally 4 Chinese formula used mild, moderate, and severe condition. This formula, all of this formula